Subscribe for daily quizzes and let me know how many you got correct today. Here's some clinical genetics trivia. Which chromosome is associated with Down syndrome? A1 or B4 or C21 or D10? The correct answer is C21. What is the common term for trisomy 21? A. Fragile X syndrome, or B. Klinefelter syndrome, or C. Down syndrome, or D. Turner syndrome? The correct answer is C. Down syndrome. Which genetic disease is caused by a single gene mutation affecting hemoglobin production? A. Cystic fibrosis, or B. Hemophilia, or C. Sickle cell anemia, or D. Down syndrome? The correct answer is C. Sickle cell anemia. What type of inheritance is seen in cystic fibrosis? A. Mitochondrial, or B. X-linked dominant, or C. codominant, or D. Autosomal recessive? The correct answer is D. Autosomal recessive. Which chromosome is linked to Huntington's disease? A. Chromosome 15, or B. Chromosome 22, or C. Chromosome 1, or D. 4? The correct answer is D4. What term describes the complete set of an organism's DNA? A. Protein code, or B. Genome, or C. Chromosome, or D. RNA sequence? The correct answer is B. Genome. Which genetic disorder is caused by a deletion on chromosome 5? A. Marfan syndrome, or B. Down syndrome, or C. Cry-du-Chat, or D. Turner syndrome? The correct answer is C. Cry-du-Chat. What prenatal test analyzes fetal DNA? A. Amniocentesis, or B. Ultrasound scan, or C. Chorionic sampling blood test? The correct answer is A. Amniocentesis. What type of genetic mapping uses recombination frequencies? A. Cytogenetic mapping, or B. Genome sequencing, or C. Linkage mapping, or D. Somatic mapping? The correct answer is C. Linkage mapping. Which syndrome is characterized by short stature and infertility? A. Down syndrome, or B. Klinefelter syndrome, or C. Prader-Willi syndrome, or D. Turner syndrome? The correct answer is D. Turner syndrome. Which genetic disorder is characterized by the absence of melanin? A. Albinism, or B. Cystic fibrosis, or C. Down syndrome, or D. Huntington's disease? The correct answer is A. Albinism. What is the term for genetic variations that may cause disease? Genetic markers, or B. DNA sequences, or C. Pathogenic variants, or D. Mutation types? The correct answer is C. Pathogenic variants. Which genetic testing method involves sequencing exons? A. Genome-wide association, or B. Whole genome sequencing, or C. DNA microarray, or D. Exome sequencing? The correct answer is D. Exome sequencing. What condition is associated with an increased risk of breast and ovarian cancer? A. Hormonal imbalance, or B. Vitamin deficiency, or C. BRCA mutations, or D. Smoking cigarettes? The correct answer is C. BRCA mutations. Which syndrome features like a long face and large ears? A. Klinefelter syndrome, or B. Down syndrome, or C. Turner syndrome, or D. Fragile X syndrome? The correct answer is D. Fragile X syndrome. What is the term for organisms with identical alleles? A. Genotype, or B. Heterozygous, or C. Homozygous, or D. Phenotype? The correct answer is C. Homozygous. What molecular technology is used for gene editing? A. CRISPR, or B. Zinc fingers, or C. RNA or TALEN? The correct answer is A. CRISPR. What medical field specializes in genetics and genetic disorders? A. Pediatric medicine, or B. Neurology, or C. Internal medicine or clinical genetics? The correct answer is D. Clinical genetics. What is the main purpose of genetic counseling? A. Cure genetic diseases, or B. Diagnose genetic disorders, or C. Inform about genetic risks, or D. Conduct DNA tests? The correct answer is C. Inform about genetic risks. What name is given to the study of heritable changes in gene expression? A. Epigenetics, or B. Genetic modification, or C. Gene therapy, or DNA sequencing? The correct answer is A. Epigenetics. Which technology employs DNA microarrays? A. Data mining, or B. Protein sequencing, or C. Genomic profiling or cloud computing? The correct answer is C. Genomic profiling. What does SNP stand for in genetics? A. Synthesis of nucleotides, or B. Single nucleotide polymorphism, or C. Standard nucleotide pair, or D. Single nucleic particle? The correct answer is B. Single nucleotide polymorphism. Which genetic disorder is indicated by an elevated level of phenylalanine? A. Phenylketonuria, or B. Albinism, or C. Cystic fibrosis, or D. Sickle cell? The correct answer is A. Phenylketonuria. What is the term for genetic variations in the population? A. Adaptation, or B. Homogeneity, or C. Polymorphism, or D. Mutation? The correct answer is C. Polymorphism. What disease is linked to mutations in the LDLR gene? A. Hypertension, or B. Diabetes mellitus, or C. Familial hypercholesterolemia, or D. Atherosclerosis? The correct answer is C. Familial hypercholesterolemia. What is the most common hereditary bleeding disorder? A. Von Willebrand disease, or B. Hemophilia A, or C. Thrombocytopenia, or D. Sickle cell anemia? The correct answer is B. Hemophilia A. What genetic syndrome involves an extra chromosome 13? A. Turner syndrome, or B. Down syndrome, or C. Patau syndrome, or D. Klinefelter syndrome? The correct answer is C. Patau syndrome. What type of genetic mutation changes a single amino acid? A. Silent mutation, or B. missense mutation, or C. nonsense mutation, or D. Frame shift mutation? The correct answer is B. Missense mutation. What type of inheritance is associated with Duchenne muscular dystrophy? A. X-linked dominant, or B. Autosomal dominant, or C. Mitochondrial inheritance, or D. X-linked recessive? The correct answer is D. X-linked recessive. Which disorder is caused by a mutation in the SMN1 gene? A. Huntington's disease, or B. Cystic fibrosis, or C. Spinal muscular atrophy, or D. Muscular dystrophy? The correct answer is C. Spinal muscular atrophy. What term refers to non-cancerous tumors associated with genetic syndromes? A. Fibromas, or B. Hamartomas, or C. Lipomas, or D. Adenomas? The correct answer is B. Hamartomas. What is the primary focus of pharmacogenomics? A. Drug response variability, or B. Vaccine development, or C. Disease prevention strategies, or D. Genetic disorder identification? The correct answer is A. Drug response variability. What common condition is screened for in newborns? A. Cystic fibrosis, or B. Down syndrome, or C. Congenital hypothyroidism, or D. Sickle cell anemia. The correct answer is C. Congenital hypothyroidism. What is the function of telomeres in chromosomes? A. Protects DNA ends, or B. Facilitates cell division, or C. Store genetic information, or D. Repair DNA damage. The correct answer is A. Protects DNA ends. What process involves the conversion of RNA into DNA? Reverse transcription, or B. Replication, or C. Translation, or D. Transcription. The correct answer is A. Reverse transcription. What condition is characterized by multiple skin tumors and K spots? A. Basal cell carcinoma, or B. Psoriasis, or C. Neurofibromatosis, or D. Eczema. The correct answer is C. Neurofibromatosis. What characteristic distinguishes autosomal recessive disorders? A. Dominant inheritance pattern, or B. Affected in every generation, or C. Carrier's asymptomatic, or D. Always fatal condition. The correct answer is C. Carrier's asymptomatic. What term describes the complete genetic makeup of an individual? A. Phenotype, or B. Genotype, or C. Chromosome, or D. Allele. The correct answer is B. Genotype. What is often the final step in diagnosis of genetic disorders? A. Physical examination, or B. Blood sample analysis, or C. Family history review, or genetic testing. The correct answer is D. Genetic testing. Which genetic disorder is known for excessive hair growth? A. Cystic fibrosis, or B. Hypertrichosis, or C. Polycystic ovary syndrome, or D. Marfan syndrome. The correct answer is B. Hypertrichosis. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.